We're in the full swing of our season 4. If you just found us, we have close to 40 episodes for you to explore. You don't need to listen to them in sequence. You can look them up and choose a la carte topics and issues that most interest you. I promise you will want to hear them all. Welcome to the Global Health Matters podcast. I'm your host, Garry Aslanyan. I'm excited to kick off the new year with a powerful 2-part episode that shines a light on the lived experiences of 2 remarkable individuals affected by neglected tropical diseases, or NTDs. In this first installment, I'm joined by Mulikat Okanlawon, a remarkable survivor of Noma from Nigeria. She is also the president of the Elysium Noma Survivors Association. Mulikat's journey highlights the challenges posed by Noma, and her experience also illustrates the strength and resilience that can emerge from adversity. Thanks to the tireless advocacy of survivors like her, Noma was officially recognized as an NTD by the World Health Organization in 2023. Later in this episode, I'm also going to be joined by Jeantet, an award-winning documentary filmmaker who has been collaborating with Mulikat for over 8 years to bring her story and the stories of other Noma survivors to policymakers, academics, and the public. Let's dive in. Hi, Mulikat. How are you today?
I'm fine. And you?
Good. Thanks for finding time and speaking to me. Mulikat, let's start by me asking you, what is Noma? I'm pretty sure that many of our listeners are not even aware. Maybe you could explain what Noma is.
Thank you for having me, and thank you for the opportunity given to me. I know that Noma starts from the mouth, and it starts with children, sometimes with adults. And it's a disease that quickly destroys the face. And also, it's 90% of the people affected by it die quickly. And also, Noma is a preventable disease, it's a treatable disease, and also it's not a contagious disease. So I think this is only what I can say about it.
I understand you were 6 years old when you contracted Noma, and like you explained, this non-contagious infection led to inflammation and destruction of the soft and hard tissue of your face. Mulikat, could you tell me more how Noma affected you both physically and emotionally?
Physically, I know it's destroyed my face, and then emotionally, it hindered me from doing many things I supposed to do on time. It affected me that I couldn't go out and I couldn't go anywhere. Even if I want to go out, I will let it be in the evening time that I will still even cover my face before going out. So it really affected me emotionally, so that because I do cry all the time when I look at myself in the mirror, of course, because I look different. So it really affected me emotionally.
Noma caused a deep open wound affecting your cheek and nose, and also damaging the bone of your eye. This caused great difficulties for you to eat and also affected your speech. Until now, you've had 5 rounds of reconstructive surgery, and you will still be receiving another surgery to repair your bottom eyelid. How did your community react towards you before and after the surgery?
People are different. some in my community, they accepted me
Mm-hmm.
the way I am. Some, they did not. Also, it's a long time process in a treatment. This thing it has happened, it has happened. So even though if other outsiders did not accept me, they doesn't have any option. Even some other people out there, some of them accept me. After the treatment, what I couldn't achieve during the process of surgery, treating myself, I achieve it. Yeah. So the places I couldn't go, then I go.
All right.
And in my community, people are associating with me. I'm mingle with people. I'm doing what I couldn't do. Yeah, I went to school. Yeah, I study. I have a diploma in information management, and also I become famous. Yeah.
I remember you told me previously, Mulikat, that before the surgeries, the children in your community were scared when they saw you, and the adults used to mock you. Because of this, you didn't leave your house very often and only sometimes went out at night. After your surgery, life changed for you, and you were able to complete your primary and secondary school, and you also gained your diploma in health information management. This is very impressive. I want to ask you about your perspective on the term disability. Disability is defined as a physical or mental condition that limits a person's movement, senses, or activities. And NOMA has limited you in many ways. However, do you identify with being a disabled person, and what does that term mean to you?
You see, I did not consider myself as a disabled, though maybe people out there, yes, of course, everyone have the way of thinking because I'm not looking like them, because I have a scar on my face. Yeah, they will be thinking I'm a disabled, that is to them, but to me, I did not accept myself like that because what they are doing, they can do, I also can do.
Right.
That is why I believe that there is ability in disability. Yes, I always said it because what you can do, maybe even me, I can do more. So everything is just the determination and everything is about to think right, to determine to become someone in life, or you want to achieve whatsoever you want to achieve in life, you go for it, you pursue it, makes it become yours. Because you can even see now, I'm in Barcelona, I'm in abroad now, talking to you today. I mean that I see myself as a disabled. I will not come out to speak out, even to speaking to you this night. It's not easy, right? Let us be realistic. It's not easy, but it takes a lot of effort, but it's good because this is what I want to achieve in life. I really want to come out on behalf of the survivor and for the survivor also out there to be encouraged that whatsoever in a situation you find yourself in life, that one shouldn't weigh you down, that you shouldn't rely on it, though there is mental thinking out of it, but you leave your past behind yourself and you face the reality.
Right.
Yeah.
You used this sentence, Mulikat. You said there is ability in disability.
Yeah.
Is that your guiding principle?
Yes, because the reason why I do use that word is that I look at myself that what you can do, even me that I have scar on my face, I can do better. That is if I really plan and I determine to do it. I think I can do better. So that is the main reason I used to say there is ability in
In disability, yes. With the clear ability that you are demonstrating, do you think it's important for survivors like yourself to be part of discussions that shape policies and agendas regarding NOMA? And if so, why?
It's very important for the survivor to be having discussion because one, the people there, they will know that it exists, and by seeing us, they will know that we are the evidence of the disease. By seeing me or by seeing any other survivor, that is the evidence so that people will know it and they will now believe that really there is one disease called Noma and there is a survivor of it. If there is any way we can collaborate with you so that we can plan together, so that people in your side also they will know about Noma and they will know that Noma exists, is treatable, is preventable because not even all the health workers that know about Noma. Some professors, maybe they read it in the book, but they didn't really believe that Noma exists. Secondly, also, it's good for survivors to be in the meeting with the people because it will still motivate them and encourage them the more in order to be open and to think right so that their mental health issue will not be disturbing them much like that. I really feel good, I'm among people that matters, at least we sit down on stage, I share my story, other survivor also share his story, then they ask questions, we answer them, it's very good a lot. Researchers should love survivor. Wherever they go, they see any survivor of apart from normal survivor, any survivor of any kind of disease. You show them love first. Interact with them. Make them feel that they are human being like you. Whatsoever you want to get from them, you will get it easily. They should try to say hi to the person. How are you? How are you feeling? I can see that you are, but I'm sorry to say. How are you feeling now? Is your health this and that? To at least to interact with that person. They shouldn't be ignore any survivor. It's not good on our part. It's not good. But when you show us love, you show us care, yeah. Even if you want to ask me any question, I will be politely and be happy to open up to you.
Mulikat, you said that you are working to change this and you're involved in many different initiatives and advocating for Noma survivors. In terms of that role, can you tell us a bit more how you do that?
I have it in my mind that the way I'm doing now, if God willing and permit me in future, I will like to help the survivors like me. So by maybe if I see one or two survivors that we can come together and think right, what can we do for other survivors out there?
Mm-hmm.
But now, by November, it will clock 2 years that Noma Survivors Association, Elysium, we created it, and which is our objective there is just to support survivors, Noma survivors,
Right.
like we were supported to get job and to have an independent life.
Mm-hmm.
So we are looking for people that we have passion like this for survivor in order for the life of survivor to change more, not by only treatment alone, by having something important to do. Since we create this association, we have more survivor like 16. We are like 16 in different countries. We have in Senegal, we have in Nigeria, we have in Mozambique, and majority of them they have their own family. They marry, they have children, So by coming together, doing this association together, they have joined it, and with little Elysium can do, when we grow more than this, we will do for them. And there are some now that they have been benefiting from it. The way they come, they will go back look different, because the treatment they receive, the surgery, it has changed their face
All right.
totally. Like me, as I first come to the Noma Hospital, I came from Lagos. The way I came that time is not the way I go back. As I went back to Lagos, people, majority are looking at me, say, how come? Is she not the one that we know? Because I look different. Even those one that doesn't want to associate with me, they come and hug me and and greet me right. So there is a lot of changes in Noma Hospital for the patients coming there.
It's truly remarkable that you co founded the Elysium Foundation, supporting survivors across 6 countries and engaging in global advocacy to raise awareness about NOMA and promote holistic care for those affected by NOMA. Thank you so much for speaking with me today. I really appreciate it, and I wish you best with all of your projects and all of your advocacy and support work that you are doing.
Thank you very much for having me. I'm really appreciate. Thank you so much.
Next, I'm delighted to be joined by Claire Jeantet, who will be reflecting on the conversation I had with Mulikat, and she will share her insights from working with NOMA survivors. Before I jump in, we want to play you a brief audio extract from one of Claire's films.
Noma is a gangrenous infection of the face, which usually starts from the gum or the gingiva to the fleshy parts of the face. It destructs the bones, the soft tissue, and everything around the face. Noma patients really have that stigma whenever they get into the society. It's hard for them to, integrate into the society because of the disfigurement on the face.
No one came to this hospital and go back remaining the same, because the way they come, they will go back different. Since the operation was done, I'm so happy. I can go to anywhere. I can stand with people at anywhere. I felt I'm a human being like others.
Claire, can you start by telling our listeners about your latest documentary film called Restoring Dignity, featuring Mulikat and other NOMA survivors? For our listeners, you will find links to this film and others on our episode webpage.
Thank you for mentioning this, Gary. We are indeed preparing a new film with my colleague Fabrice Caterini. And this is looking at these efforts that survivors are leading, the way they are challenging or way of approaching such an issue as NOMA. And we are very grateful for Mulikat to still accept our camera 8 years after, and to allow us to witness closely this process and make sure that we are documenting this very unique process of survivors being at the forefront of policymaking.
I know you've been with her in many high-level meetings. Having someone with a lived experience who was sharing her actual experience with NOMA, how do you think that this really influences the policy and decision makers when they consider these perspectives, sometimes they're not even aware of?
It's a very good question. It's changed everything to have Mulikat or another survivor at the table and discussing with decision makers. This is often the first time they hear about Noma and meet with somebody who has been through the disease.
Mm-hmm.
They can see the scars. They can hear firsthand the testimony of someone who is not even supposed to be here. Mulikat is one of the very rare survivors of the disease. It's only estimated to be less than 10% of the people surviving the disease. So meeting with somebody who has been through this is very impressive for most of them. And I think it also helps them to shape policy in a way that it really responds to the needs of the people, of the communities affected. It gives a sense of urgency. It gives a sense of accountability also. And this is something to be not done only once, but repeated over time.
One of the things that was really very interesting for me to, I mean, I kind of knew, but get affirmed in looking into Noma in conversation we had with Mulikat is just lack of awareness, not just among policymakers, decision makers, but sometimes even health workers. And to extent that they are not aware sometimes of Noma and how to support people and what could be done in this area. What do you think from your experience, kind of shadowing this issue for such a long time? How can we raise that kind of awareness to begin with, even with health workers?
This is crucial because of the nature of the disease itself. Noma is a striking disease. Most of the people would die in only a few weeks, and they live in remote communities. They do not have access to healthcare or not easily. So training healthcare workers, but also traditional healers and communities to detect the very first symptoms of the disease is really crucial. This is something we have witnessed a lot of progress in the past years and since the addition of Noma to the NTD list, but there is still more to be done.
Another kind of reflection on this specific issue, NTD or neglected topic, is that many of our listeners work on various global health advocacy topics. Do you have any suggestions to those involved in advocacy on how to involve people with lived experiences, what you've learned through that process, and any suggestions for people involved in those causes?
It's not an easy process to involve people with lived experience. Often it requires a lot of time and resources and extra effort from people working in advocacy and global health. But this is also a very rewarding process. It requires to build trust, to really take time to build trust, to sit with the people, to understand their needs, to make sure that they are comfortable, that they can travel. This is a very simple thing, but already that they are able to get visa and attend these important meetings in different countries. And this is through this repeated positive interactions that we can allow them to share their experience and really contribute to policy.
One of the achievements that helped to put a spotlight on Noma was it being added to WHO's list of neglected tropical diseases in 2023.
I would say that people with lived experience, survivors, these very rare survivors like Mulikat, have been totally driving these efforts to get Noma on the NTD list. They were the key factors that changed everything.
Yeah.
Mulikat was next to the Minister of Health of Nigeria when he announced that he will be leading on this case. Survivors from different countries have been following the process, and they have been really the ones leading all of us, our collective efforts to make this change.
Yeah, that's a really good input into how these things ought to be approached.
Maybe just one thing that I can add is that there is a growing interest for involving people with lived experience. More and more, we are seeing initiatives inviting them to different meetings, etc. But this is not enough to make sure that they are involved. We should also collectively make sure that they are comfortable. I'm always very grateful. I feel grateful for Mulikat and for other survivors that they are making this effort to share their story with us. It requires a big effort. They have been going through a lot of trauma, a lot of pain, physical pain, discomfort, discrimination. So I think this is very important that we are trying our best to make sure that they are comfortable and we acknowledge their courage.
Thanks for all of these really valuable pointers and your reflection, Claire. Much appreciated. Thanks for joining us today. Good luck with everything that you do.
Thank you very much, and thank you to Global Health Matters for looking into this important topic.
Both Mulikat and Claire emphasize the vital importance of including people with lived experience around the planning and decision-making table. Their contributions go beyond providing valuable insight and knowledge to shape future programs and policies. They are also a driving force in catalyzing meaningful change. I encourage you, our listeners, to tune in to part 2 of this episode. In this continuation, I'll be speaking with Dan Izzet, who will share his powerful and deeply personal journey of living with leprosy. Now let's hear from one of our listeners.
Hello everyone, hello Gary, greetings from Bangkok. I'm Liang Wu. I began listening to the Global Health Matters podcast back in 2022, right after I started my career in the health sector. Since then, it's been a companion that keeps me engaged with the latest trends and important conversations in global health. One thing I love the most about the podcast is how it pulls in such a variety of voices, from researchers to frontline health workers. It's a wonderful and carefree way to stay on top of what's happening in the global health, since I love to listen while I am commuting, cooking, or even winding down at night. One episode that really resonated with me had a guest say, "Poverty is the disease, tuberculosis is the symptom." That simple yet powerful statement struck a chord and made me think more deeply about the social roots of health issues. Going forward, I'm expecting more episodes on how artificial intelligence could be harnessed to promote health. Thank you.
Thank you for sharing what you enjoy about Global Health Matters, Liang. We appreciate your suggestion for an upcoming season. To learn more about the topic discussed in this episode, visit the episode's webpage, where you will find additional readings, show notes, and translations. Don't forget to get in touch with us via social media, email, or by sharing a voice message. And be sure to subscribe or follow us wherever you get your podcasts. Global Health Matters is produced by TDR, a United Nations co-sponsored research program based at the World Health Organization. Thank you for listening.